Good morning, mga kasangbahay! Here I am again, Dr. Sarah Barba Cabudil, your host at Doctors on TV. And it's nice to see you all again. Sama-sama po nating tunghayan mamaya ang panibagong topic na muli ay inyong mapapakinabangan dahil mahalaga ang may alam, lalo na't usaping pangkalusugan na makapagpapalawak ng ating mga kaalaman. Pero bago po ang lahat, mga kasangbahay, we would like to invite you to follow and subscribe our social media accounts. Please like and follow our Facebook page at www.facebook.com/doctorsontv and like and subscribe to our YouTube channel. Just type www.youtube.com/@UNTV News and Rescue. And you can actually send us questions and comments po sa mga pages na yan. Kung kaya after liking and subscribing, i-share nyo na din po sa inyong mga friends and family. Handa na ba kayo mga kasambahay sa mga panibagong kaalaman? Here's our topic for today, a medical condition called scoliosis. Let's watch this brief information regarding it.
According to the Philippine Orthopedics Center, or POC, scoliosis is a prevalent medical condition in the country. In 2017, the POC reported that they treated around 4,000 scoliosis patients, with most of them being children and adolescents. The number of scoliosis cases in the Philippines is expected to increase due to factors such as poor posture, lack of physical activity, and genetic predisposition. In addition to the POC, other hospitals and healthcare facilities in the Philippines also offer scoliosis treatment and management. Early detection and treatment are essential in managing scoliosis and preventing complications. Patients with mild to moderate scoliosis may be managed with non-surgical interventions such as bracing and physical therapy, while those with severe scoliosis may require surgery. Overall, scoliosis cases in the Philippines continue to be a significant health concern, and awareness, education, and access to treatment options are essential in managing this condition.
Ayan mga kasangbahay, very concerning condition din po talaga ang scoliosis. And it's very important to have a knowledge on this dahil karamihan po talaga ngayon ay limitado o wala na pong physical activities na maaaring mag-cause ng bad body posture. Kaya mga kasangbahay, for more details, stay tuned. Doctors on TV will be right back. Welcome back, and now let's delve into the world of scoliosis. We have invited a medical specialist guest who had dedicated her career to help people with scoliosis. Let us welcome Dr. Pebbles Ganal-Antonio, an orthopedic spine surgeon from Makati Medical Center. Good morning, Doc Pebbles, should I say? Welcome to Doctors on TV.
Hi, Doc Sarah. It's so nice to see you again.
Yes, of course. Actually, she's Dr. Kathleen, but you know, matagal natin siya naging kaibigan. And of course, nakasama natin ng matagal na panahon dito sa UNTV. Okay, kaya can we just call you Dr. Pebbles?
Sure,
Doc Pebbles.
sure,
Okay.
Doc Sarah.
Ito nga, Doc Pebbles, thank you very much for this time that you're giving. No? Kasi marami tayong matutulungan, napakarami rin may scoliosis, hindi ba? And of course, okay, so for introduction lang, Doktora, no? Let's watch this and learn about what scoliosis is.
Scoliosis is a medical condition characterized by irrational deformity, creating an abnormal curvature of the spine. In scoliosis, the spine may appear to have an S or C shape instead of the normal straight alignment.
Ayan mga kasambahay, naku, ang scoliosis pala isang medical condition na ang apektado ay ating spine. And ito nga, Doc Pebbles, no, panimula. Okay, so can you please explain, ito yung ating first question natin would be, usually natidinig natin lagi si scoliosis. Basically, paano natin i-define to yung mas mag-grasp ng ating mga viewers?
Okay, so pag tinignan mo kasi yung spine natin, halimbawa, tingnan kita diretsong ganyan, di ba? Pag nag-x-ray ka, yung itsura ng spine mo, diretso siya.
Okay.
Pero pagka may scoliosis tayo, ang nakikita natin, instead na diretso, parang
Paling.
Oo, paling siya.
Okay.
Para siyang may S or C shape na curve. And that is because umiikot yung buto natin. Yung spine natin mahaba siya. It's made up of 33 bones. But not all of them are actually moving, no? And so, particularly, the thoracic at saka yung lumbar.
Thoracic yung sa tapat dito sa may parang
sa may
chest natin.
tadyang.
Sa likod.
Oo.
Tapos yung lumbar is dito sa
lower
may
back.
Okay,
Oo.
lower
So,
back.
nangyayari, umiikot yung mga buto. Kaya nagkakaroon tayo ng deformity na tinatawag.
Okay. Pero di ba sinasabi na may normal curvature naman?
Correct.
Oo.
Tama ka
So, paano
dyan.
paano na-identify na ito ay parang part lang siya ng normal curvature ng back
Okay.
in contrast to scoliosis?
So, ang spine natin, dahil gumagalaw nga, we can have a normal curvature. And if you measure it, minsan nag-chest x-ray, tapos sasabihin, ay, mild scoliosis. Tapos, pag sinukat mo naman, less than 10 degrees lang pala siya.
Okay, so may
Kasi-
degrees. It depends
Yes.
kung gaano yung
yung laki
kurba.
ng kurba.
Okay.
So, smaller it is, no, something that is less than 10 is considered normal. Ibig sabihin, sa pagtindig lang, sa posture. Pero pag mahigit doon, then sinasabi natin na may scoliosis. And when I mentioned that it's rotational, umiikot siya, tinitingnan din namin, may certain features dun sa x-ray na nakikita natin na it gives us an inference na yung buto hindi siya diretso, kundi umiikot siya. So, kaya nangyayari na nagkakaroon tayo ng deformity.
Okay, so you mentioned about rotation. So, does age has something to do with this?
So, kanina we talked about, if you talk about scoliosis, maraming klase kasi ng scoliosis. So, merong scoliosis na nakikita na natin sa may edad, no? Ang tawag na natin degenerative scoliosis, no? Meron tayong nakikitang scoliosis na yung sa mga teenagers, yan yung adolescent, at ang pinaka-common na type is idiopathic, hindi namin alam yung cause. Meron din nakikitang scoliosis sa baby pa lang, no? At makikita natin kasi maaring iba-iba yung shape ng buto
So, at
niya.
that very young age, pwede pala.
So, pwede siya even at a very young age. So, if you will look at the types of scoliosis, marami siya, no? Hindi lang siya yung, pero I think for our discussion today, yung most common type yung pinag-uusapan natin, yung idiopathic. Kaya sinasabi ko na rotational siya, umiikot siya. Pero kung halimbawa, nung pinanganak yung bata, tapos yung shape ng buto niya, iba-iba, no, dapat ang shape ng buto, square or rectangle, tapos naging triangle siya, o kaya hindi buo yung square niya na buto, then that is what we call congenital. Kasi iba na yung shape ng buto niya, kaya nagkaroon siya ng deformity.
Oh, okay. So, balikan natin si idiopathic scoliosis.
Which is what we're gonna
Okay,
be
yung pinag-uusapan natin. So, upon diagnosis, idiopathic kasi sabi mo of unknown etiology, hindi
Correct.
alam kung ano yung sanhi.
Correct.
Okay, but does it happen na, di ba, eventually may mga test na ginagawa, nagkakaroon ba ng instances na later on nakikita na rin, na-investigate kung ano yung naging sanhi nitong scoliosis?
So, right now, maraming studies na ginagawa, but we have not identified a particular gene, kaya hindi natin masabi siya na genetic talaga, pero it leans towards that. And then we do see it in family. So usually may family history din yung patient, either yung nanay o yung pinsan meron, pero hindi pa natin talaga ma-isolate kung anong eksaktong cause para sa kanya.
Okay, but whatever the type of scoliosis is, does the manifestation or do the manifestations differ ba? Kung sa magkakaibang type, kunyari sa matanda, degenerative, okay, hindi alam yung which is yung most common naman, which is idiopathic, and then yung meron sa adolescents, no? Nag-iiba ba yung mga nararamdaman ng mga symptoms or nakikita mga senyales kung magkakaiba yung type ng scoliosis?
So, usually, halimbawa sa newborn, no, pagka meron, well, eto kasi hindi ka naman nag-routine x-ray sa patients na bagong panganak. So, usually, hindi yun na-detect until later on when the patient probably is more upright, tapos they're standing up, and then the parents notice, may nakikita na.
Usually, ano ba yung unang mga nakikita? Kunyari baby, hindi pa pinansin, pero usually at how young na yung bata na may makikita ka ng difference dun sa posture?
Siguro, if ever, we can focus our discussion on idiopathic, not the congenital type. Para lang, kasi that's the more common type.
Pero kahit yung usual type, pero pagka ganon, how young yung bata para medyo nakakita ka na ng difference dun sa tindig niya?
Okay, so let's concentrate on idiopathic para hindi confusing for our viewers. So idiopathic, we don't know the cause, and we can see it in young age groups, no? And oftentimes you see it in the adolescent age group. And why Why is that? It's because this is the period they grow taller fast. Ito yung during the growth spurt. So during the growth spurt, syempre humahaba yung spine. So kung meron siyang deformity, doon niya mas nagiging apparent. Usually, ang nakakapansin magulang kasi napapansin hindi pantay yung balikat. O kaya minsan hindi pantay yung palikpikan sa likod. Napapansin nila mas prominente yung palikpikan on one side. Tapos dun sila mapapaisip, bakit ganyan siya, no? O kaya makita nila yung waist, hindi pantay, nakapaling on one side. Pero yung bata, wala siyang nararamdaman. Hindi siya usually nagrereklamo na may masakit sa likod niya or meron siyang limitasyon sa ginagawa niya. Pero napapansin yun usually ng mga tao around them na parang hindi siya diretso. Tapos from there, dadali na yan sa doktor. Pag kumuha ng x-ray, makikita doon, ay meron ngang hindi nga diretso yung likod. And so that's what they end up seeing us in our clinic. So to answer your question, it is often seen during the growth spurt years, that is usually sa kababaihan right before their menstruation or during the period that they first get their menstruation. And then sa kalalakihan, ang growth spurt nila is usually around age 14. So tinitingnan natin yung nagpapalit na yung boses nila, meron ng konting hair, ganyan. So yun yung period na pubertal na tumatangkad sila. Dun mas often napapansin ito.
I see. Okay, ito yung mga napapansin, yung mga senyales. How about symptoms? Meron bang nararamdaman kaagad yung pasyente kapag yung pala meron pala silang scoliosis? That's why.
So, earlier I mentioned na usually it is noticed by somebody outside rather than the patient kasi hindi naman oftentimes na nagmamanifest ito with other symptoms such as back pain, no? In fact, it is a myth, no? A patient with scoliosis and a patient with a straight spine will have the same risk of getting back pain. But it seems like a patient with scoliosis will more often report back pain kasi they're more aware of their backs versus a person who doesn't
kasi conscious sila
kasi mas conscious sila.
Okay.
But yes, there are on occasion that patients will complain of back pain, but mas minority sila. Mas karamihan dyan, walang back pain na nararamdaman. Hindi rin sila nahihirapan mag-perform ng activities nila. They can engage in sports, no? So, typically, symptom-wise, hindi siya very apparent na may nararamdaman unless, of course, you have scoliosis that are very large na. So, they may manifest.
When you say large, masyado nang malaki yung angle ng curvature.
Mga 90 degrees, ganyan. Yung malalaki na
malaki ng ganong kalaki talaga.
Maaari siyang lumaki ng ganon. So, maaaring they can start feeling madali silang mapagod kasi napakompromise na ngayon yung heart and lung functions.
But in the event na magkakaroon na ng pain, dahil malaki na yung curvature, how painful can it get?
Well, I have patients with very large curvatures and yet they don't have pain. So
it's not always
not because
the case
of
na may pain talaga.
Correct. And the pain is not even related to how big your curvature is.
But if kunyari wala, so does it mean na parang aesthetic lang ba or ang pinag-uusapan sa scoliosis or may mga limitations din sa mga activities because of this condition?
Alam mo, that's a very good question. Actually, kung titingnan natin talaga, pagka pwede mong tingnan siya na ang scoliosis is an aesthetic condition kasi nga hindi pantay yung balikat, minsan yung leg, mas mataas sa isang
pero kasi minsan din naman, may mga habits din talaga yung mga iba't ibang individuals. Like sabi mo kanina, pwedeng hindi pantay yung balakang. But of course, merong pag lumalakad, parang mas graceful sila maglakad, di ba? I mean, I think these things matter also para medyo confusing whether that patient has scoliosis or not. Okay.
So, we'll talk about diagnosis, but let's say yung sinasabi mo nga yung paling yung isa, minsan pala hindi pantay yung binti, hindi nila alam. So mas mahaba yung isa, kaya pala naka-tilt yung pelvis.
It's not because of scoliosis.
Tapos nagkakaroon na sila ng scoliosis.
Secondary. Pero hindi yung primary talaga.
So maaring dahil hindi pantay, kaya hindi dumiretso na yung spine.
But yung ganong klase ba, is it very common na hindi pantay yung limbs?
Hindi naman
kaya
siya very common.
Para magkaroon ng scoliosis.
Pero we do see
that happens.
That happens. So when it comes to aesthetics, there is really an aesthetic component kasi nakikita hindi pantay, ganyan, tapos nakaka-conscious, di ba? Pero there is also a medical component kasi kung masyado nang malaki yung kurba niya, then obviously, that can now compromise yung chest natin. So, ma-compromise, maaring maapektuhan yung function ng puso, ng baga, kasi sobrang laki na nung kurba natin.
And also, if ever, at a younger age, nagkaroon ng ganitong condition na nag-grow pa. Tama
Yes,
po
so
ba?
yes, kasi doon pa nag-expand yung lung, doon pa lumalaki yung rib cage natin
Yes,
to accommodate the heart and the lungs, no. But going back to idiopathic wherein we talk about adolescents, no, then hindi naman talaga, kung titingnan natin, wala talaga silang manifestations masyado ng cardio and pulmonary compromise kasi usually these curves are not yet in that very high end of the spectrum, no. But so yes, so the patients would have both aesthetic and medical sabihin natin
May impact.
Impact, yes.
Okay. But of course, syempre, sige, dun sa aesthetic, okay? Kasi sa medical, usually talaga namang there will be indications na kailangan ipamanage. Now, sa aesthetic, sometimes, it's basically kung ano yung priority. Sometimes ganun, di ba? Kung how conscious that patient can be. Okay? And with regards to that, meron ba siyang emotional and psychological impact also?
So, when you look at aesthetics, it's not just purely aesthetics yung maganda kasi yung nakikita din natin is dapat yung ulo natin nakabalanse sa balakang. So, syempre, pagka nakaganon ka, no, kasi dahil sa scoliosis mo, though aesthetically not pleasing, that also may cause some strain, diba? And obviously, that has an impact on the child. When you also look at it psychologically, and emotionally, pag ang laki ng curvatures nila at makikita mong hindi pantay ang balikat, talagang medyo nako-conscious sila. Kaya makikita mo na meron din talagang impact dun sa pasyente with regards to the patient's emotional status.
I see. And usually upon coming to your clinic, ano yung mga diagnostic procedures that you subject the patient to?
Okay. Commonly, they come already with a chest x-ray. Pero pagka wala pa, no, tinitingnan ko yung of whatever they have, no. But then routinely, if I do suspect that the patient does have scoliosis, then I will ask for a scoliosis x-ray. It means that they take the x-ray of the whole spine standing up, and then they take an image that would encompass the base of the neck or sometimes the entire neck all the way to the balakang.
I see. And meron din ba siyang degrees of severity?
Yes, you do have degrees of severity. So anything that is less than 20 is considered mild. Anything that is between 20 to 30 or 40 is considered moderate. And anything that is above 50 is considered severe.
I see. And management-wise, ano yung imperative na dapat at what degree? Pag mild ba, talagang kailangan na talagang mag-start ng management? Or how do you usually manage mild cases of scoliosis?
So in mild cases of scoliosis, we do consider their age. No? If they are already skeletally mature, then oftentimes it will not get any bigger. No? Especially in the thoracic spine. So you may opt to monitor the patients on a regular basis, and if you do see that there's no change, then you can have the x-rays less and less frequently. So it's basically
there's like regular monitoring
lang. But if you have a patient that is still growing, no, and then nandun tayo sa moderate curves, then you may want to start them on a brace. If we have patients naman who have severe curves, then that's when we talk about already correcting it. Not just because it's aesthetic, but because we do not want to have the medical complications later on in life.
So that can compromise other functionalities.
Correct. Yes.
Okay, dun sa moderate, the use of braces, usually on the average, ganong katagal siya sinasubject sa isang gamit ng brace?
So, when I have my protocol kasi is, I would want them to wear it 23 hours, 7 days a week.
23 hours, 7 days a week.
So, that means they wear it all the time. They only remove it when they take a bath, no, or when they do their exercises. But otherwise, they wear it all the time. And then, I also monitor their skeletal age because as they are already getting older, no, tapos tumitigil na yung pagtangkad nila, then we can start weaning them off their brace. Ibig sabihin, babawas-bawasan na natin until the point wherein we can completely take it off.
Okay, pero maganda ba yung, mabilis ba yung progression? I mean, no, not the progression of scoliosis, rather the improvement of the condition.
Well, you will see that when a patient wears the brace and then you get an x-ray, you will really see change, no?
Well, at least of how long yung nagamit, time duration.
While the patient is in the brace, then you take x-rays pa rin. Kasi tinitingnan mo, pwede kasi pa rin siyang lumaki kahit nagbe-brace yung pasyente.
So, more so kapag hindi naka-brace. So, dapat talagang sumunod kina doktora, no?
So,
yeah. Pero kasi curious lang ako, how uncomfortable it is for the patient to be using that? Kasi ang prescription would be like 23 hours for like 7 days. So literally parang yun nga, pag magpapalit ka lang ng damit, diba?
Correct. When you just take a bath and do your exercises. So, but of course, let's say when they do their I have patients na, the divers, gymnasts, ganyan. And I tell them, when you do these activities, you take off your brace. So that's time off your brace. Hindi ka naman nagda-dive buong araw, 7 days a week.
But how about when you're asleep?
You take it. They get
mahirap?
Hindi naman. They get used to it. Of course, in the beginning, there is some adjustment that they have to do. Sometimes you can see that they're really uncomfortable. Mainit kasi, we're in a tropical country. But after some time, they get very used to it. And luckily, kasi they are adolescents, nakakausap mo na sila like an adult. Napapaliwanag mo bakit kailangan. And so, before you actually put a patient on a brace, it has to be a decision that is made by the family themselves as well. And the patient has a very big say on it. Because kahit magpagawa ka, hindi naman niya gagamitin. Walang saysay.
Oh, okay. And eto doc, we've been talking about idiopathic scoliosis, no? Can you get like scoliosis from an injury also?
No. Well, unless
or like can it be secondary to some like infectious
yes, from infection, yes.
Yeah.
Oo. But if you're talking about, alam mo, masagi ka ng bus, tapos bigla ka magka-scoliosis, hindi mangyayari yun. Unless, of course, it's a fracture dislocation of the spine or an injury that will now cause a deformity in the spine.
So, this seldom happens.
But the one from infection, yes, no? Because pag nasira na yung buto, pwede siyang magkaroon ngayon ng mag-iiba yung shape ng ating spine.
I see. How about some environmental factors? Meron bang gano'n na nakaka-contribute sa scoliosis?
Often, may magtatanong sa akin, kasi backpack ng backpack eh.
Yeah, di ba? Laging nakaganda sa bibigan. Ang dami kayang books, no? Buti nga dito nag-online setting.
Kaya
na,
pwede
diba?
ng
Kahit gadget na lang.
Oo.
Pero this is a serious question kasi kawawa nga yung mga bata. Imagine sila pa yung pinakamaraming.
Kaya lumaki tayo, naka-backpack, tsaka yung ginagano.
Hindi, pero not everyone can afford the trolley, di ba? Paano yung mga hindi? So, does that really affect the
so
posture?
there have been studies already. So backpacks do not contribute to your scoliosis. So you can use a backpack. And wearing a backpack you will not end up having a scoliosis.
Pili ko nga mas balance pag backpack kasi kung nasa rather than nasa isang side.
Maari kasi.
Does it make sense?
Kaya nagba-back pain kasi tama ka. Hindi tama yung paggamit ng backpack. Diba?
Yeah,
ang nangyayari either isang side.
Kaya mas nakatagilid. Pero kung kunyari,
hindi siya magkaka-scoliosis dahil doon.
Hindi pa rin talaga. Kasi we know how stable the skeletal system is, no? Naku, teka, ang dami na nating kwentuhan and I'm sure nagiging interesting na rin to para sa ating mga viewers, no? Pero sandali lang, ayan po mga kasambahay, mga patikim pa lamang po yan. Later, we'll be discussing about the challenges and triumphs of living with this condition. So sit back, relax, and stay tuned. Doctors on TV will be right back. Ngayon po ay magpapatuloy naman natin ang nasimula natin kanina with Dr. Pebbles Ganal-Antonio or Doc Pebbles. And to be more knowledgeable sa topic natin today, panoorin po natin ang pakikipag-ugnayan ng ating pasyente para po ipakonsulta ang kanyang kondisyon sa espesyalista ng Makati Medical Center.
A 25-year-old lady, Jillian Bondok, was diagnosed with mild scoliosis when she was just third-year college back then, around 17 years old. Since then, no follow-up checkups have been made, and now she experiences a slightly curved posture and time-to-time back pain, especially during stressful days.
Thank you, Makati Medical Center, for assisting our patient. Siyempre, kasama po natin ngayon si Dr. Pebbles or Dr. Ganal-Antonio na nagbigay po ng kanyang oras para mapaglingkuran po ang ating pasyente. Thank you, Dr. Pebbles. And kamusta naman po yung naging check-up sa inyo ng ating patient na si Miss Jillian Bondok?
Si Miss Jillian, she's a lovely patient. No? She was quite anxious, no, because when she was young, she was diagnosed of scoliosis. So, medyo kinakabahan siya, no, na baka nga may kurba. Tsaka very typical, no, ang worry nila, baka ooperahan na sila. Hindi lahat ng scoliosis kailangan operahan, ha? Kaya tumitingin ako sa viewers. Hindi lahat kailangan. So, in-examine ko siya, tiningnan ko yung likod niya. Pansin ko naman, hindi ganun ka-obvious yung deformity sa likod niya. Pero pantay, talaga makita mo may konting hindi pagkapantay. No? And so, pina-x-ray natin siya, and I think in a little bit if a flash, at nakita namin sa x-ray niya na actually maganda yung likod niya. It was actually quite straight, no? At wala akong na-appreciate na kurba, no? So, normal yung findings natin
So,
sa
at least that's
X-ray.
good. No? Nagkaroon siya ng relief from dun sa worry niya kasi
Correct.
because of yung previous
Yes.
diagnosis.
Yes, na talaga yung most important, yung relief niya from the worry na baka may scoliosis at kailangan siyang operahan. She was also complaining of some back discomfort, no? And that one, we'd say, really muscle-related siya. Maaring
So,
sa
definitely
posture.
it's not related to scoliosis.
Yes.
Kasi wala nga siya.
Oo. So,
Okay.
you'll see in this case na kahit may back pain, pag x-ray, wala palang scoliosis. So, hindi ibig sabihin pag nagma-back pain, may scoliosis tayo, no?
Okay. And so, because of that, so wala tayong treatment plans for her.
I will just encourage her to continue engaging in her regular activities, make sure that she does regular exercise. This is really more for her back pain than her perceived scoliosis or the previous diagnosis. So, in a patient with a normal spine, katulad niya, then mas maganda talaga na nagkakaroon tayo ng regular exercises. You can do back strengthening exercises, core exercises, no? And always maintain proper spine mechanics. Halimbawa, sa pagkaupo natin, pag nagtatrabaho tayo ng matagal, kailangan tumatayo, nag-stretch, ganyan. Also, if you are standing up for long periods of time, maganda na may stool para nakapatong yung mga little things like that, no? And avoid lifting repetitively heavy weights, no?
I see. And of course, sa case si Jillian, ano, so any advice na lang para sa kanya?
So, for Jillian, congratulations, wala kang scoliosis. Kahit na maganda ka, sabi nila, sakit daw na magaganda ang scoliosis.
Okay.
Pero sa atin, no, we didn't see any significant curvature. So that means you are clear from scoliosis at hindi na siya magde-develop kahit tumanda ka. I think that's the most important thing. So you can engage, do not be hesitant to do sports, to do exercise, to carry on normally, no? It is okay, and I would
Physical
encourage you.
activity really matters a
Correct.
lot.
Correct.
Okay, yan. So, congratulations. And, ayan, that's great news. Jillian Bondoc. Okay. And, eto, Doc, no, how about naman sa mga pasyente po? Kasi kanina na pag-usapan natin yung may mga moderate scoliosis, no? Yung sa pag-wearing of braces, ganyan, how often, and the importance of regular monitoring. How about yung may mga severe cases na natin? Ano yung mga interventions that we recommend sa kanila?
So let's say we see patients already with severe scoliosis and we do recommend correcting, no, the deformity. And so that means hindi naman namin yun makokorekto sa sahi lang, no, or sa exercise lang. Kahit magsabit ka pati warik, hindi magdediretso
These are
yung spine.
bones.
So basically, we do have to address this surgically. So, pagka may pasyente tayo for surgery, of course, we prepare pa rin physically, no, and emotionally the patient. So, physically, dumadaan pa rin yan ng medical clearance. Hindi porket pwede ka operahan ka sa scoliosis, ipapasok ka na lang sa operating room nang walang medical Oo. So, examinin siya either ng pediatrician o ng cardio, ng mga subspecialists na she's fit to undergo this procedure.
Because this is a major surgery.
Because it is a major surgery. So, that is what we do to prepare the patients for. Of course, there are several diagnostic imagings that we will probably be asking, like more x-rays. Sometimes there are doctors who would ask for CT scan, MRIs, depending on the intervention that they are planning to do for the patient.
I see. Okay. And usually, this kind of surgery po, ganong katagal yung
Duration ng surgery.
niya?
Well, depende kung gaano kahaba din yung segment na aayusin natin.
Yung minimum, and so far sa experience mo, Doc Pebbles,
Well,
yung ganong katagal din, yung parang the most severe that you have encountered so
naku,
far?
wag yung most severe, yun na lang average.
Parang
Baka matakot.
Mamaya mo na lang ibulong.
So, on the average, it could take about 6 hours.
6 hours. Okay. But seriously speaking, that's 6 hours, and then pagka mas severe, of course, longer, no?
Sometimes when we do have more complicated curves, there are more procedures that we have to do just to correct the deformity. So that may take a little bit longer also.
How about the recuperation stage? Ganong katagal makarecover yung isang patient who has undergone surgery?
So, kaya mahalaga yung emotional preparation, no? Because after surgery, of course, ang sakit niyan, para kang binubog ni Manny Pacquiao, hindi mo alam kung saan mo ipoposisyon kasi masakit talaga, no? Pero hindi ibig sabihin masakit siya habang buhay. Siyempre, kahit any sugatan ka lang, masakit di ba?
Yeah.
So, mas malalim tong sugat na to. So, usually in the first 2 days after surgery, mas masakit siya. Pag inoperahan, syempre kahit any surgery naman, no, masakit siya. No, unang araw talagang parang binubugan ni Manny Pacquiao, masakit, hindi mo alam saan mo puposisyon yung katawan mo. Pero kaya nandyan din yung ating pain specialists. Our anesthetists are our friends. They help us with controlling the pain post-op so that we can move the patient. Kasi ayaw din natin nakahiga lang siyang ganyan. So on the average, I'd say about on the second day after surgery, the patients can tolerate already putting up their head, parang moderate high back rest. And I do have patients na on the second day, nakakaupo na sila.
Oh.
Kaya mahalaga yung emotional preparedness.
So, pwede naman palang hindi matakot kasi medyo mabilis din naman ang recuperation.
No? So, depende yan. Individuals ang pasyente natin. Kaya ang hirap mag-predict sino yung mabilis lumaki yung kurba, sino yung mahihirapan sa surgery. Kasi individuals ang pasyente
and
natin.
well, again,
diba?
it depends also dun sa age factor pa rin, diba?
So, what we see here is that on the average, no, on the second or third day, they are able to sit up and dangle legs and maybe even walk to the toilet. And then, so the average hospital stay after surgery would range from 4 to 7 days. Depends on how fast the patient will actually get up from bed.
Okay, but how about the timeline we're talking about when we talk about
Going back to their activities.
the previous routine nila
Alright.
prior to surgery?
Of course, like in anything, they have to go through a period of recuperation, no? So, gradual yan. So, una, binabantayan lang natin yung pain nila from the surgery, yung sugat natin, no? And usually, after the first month, maganda na yung peklat. Diyan na papasok si Doc Sara para gumanda lalo yung peklat ng patients natin. And then, we can do some physical activities, some mild stretching exercises, no? And we gradually increase this until usually at the 6th month after surgery, we can allow them to do more or less, no, their vigorous activities already.
But that's not bad, okay? And how about the risk po pagka mag-undergo ng surgical operation?
Ako, yan ang very common na concern. Kaya I do have patients, yung parents
Kasi
na
yung fear
umiiyak
nila,
talaga
diba?
sa clinic.
Parang, could they just accept the fact na meron silang gantong condition or like face these risks, okay?
So, in any surgery, whether it's spine or any other, alam naman natin na may risks. And of course, spine surgery always has that stigma that talagang the risks are high. And totoo naman talaga. So, we do have ways to lessen or increase our spine safety, no, in surgery. And one of them is using what we call intraoperative neuromonitoring. So that means during surgery, meron tayong nagmo-monitor ng conduction ng nerves natin from the brain to the feet, no? So, habang ginagawa namin yung critical steps ng procedure, yung kung saan naglalagay kami ng instruments, kung saan inaayos na namin, dinidirotate o dinidiretso na namin yung spine, yun ang mga critical steps namin. May nagmo-monitor at pag nakikita nila na bumabagal yung signals, they tell us, parang an alarm is signaled or set, and so we have to stop, no? And we have to trace back, no? And there's an algorithm already of steps na kung anong ginagawa pag an alarm has been raised. So that's one, no? And secondly, we have now parang a mapping system, no, for the spine, no. Para siyang GPS. In a way, it tells us where we are at the time, no. So it's called image-guided surgery. So prior to surgery, the patient undergoes an imaging called CT scan, no. And the CT scan is fed into the machine, and the machine now generates a three-dimensional image of the spine. Some of my colleagues, no, especially in very, very large deformities, can even use this to do a 3D printing. So you kind of have an idea yung trajectories, no? But intraoperatively, no, you can use this image na generate nitong machine na to, and that machine also has what we call probes or arrays na mangyayari habang nilalagay mo yung tinitingnan mo yung entry points, yung paglagay ng instruments mo, nakikita mo siya in real time. So na-avoid mo yung nerve injury.
Okay, so talagang yung risk dito sa pag-undergo ng mga surgical operations, pag inaayos, nag-manage yung scoliosis, talaga very diminished na siya. I mean, as compared before, years ago.
Yeah, so,
okay, kasi nakita natin yung mga diniscuss mo, parang they all provide a better accuracy.
Yes, no? Correct. It improves our accuracy and it increases the safety in our spine surgery.
Ay, sino ko, thank you very much, Doc Pebbles. With having mentioned all those, would you like to invite our viewers, no? Kasi with the advancement of the technology that you have in your department here at Makati Medical Center.
So, for our viewers who are worried about if they have scoliosis or not, una, hindi lahat ng nakikita natin sa chest x-ray tunay na scoliosis yan, ha? So, kailangan pa rin natin siya i-determine, no? Go see your spine specialist. Marami kami all over the Philippines. So, please don't worry. Baka magiging anxious tayo. So, una, i-determine muna natin kung may scoliosis or wala. Kung tayo talaga ay may scoliosis, then maganda ang follow-up. Follow up with your doctor, make sure that you see them on a regular basis because sila din ang tutulong sa inyo. Kung kailangan ninyo mag-brace, then make sure that you wear your brace. Sayang naman gagawin, hindi gagamitin. Exercise ng exercise kahit naka-brace o walang brace kasi pwede po tayong mag-exercise. And if kailangan talaga tayo umabot sa surgical intervention, napaghahandaan po yan. Hindi po ito emergency. Talk to your doctor, talk to them about safety in spine surgery, talk to them about recuperation and what to expect after surgery so that when you're there in that situation, mas prepared tayo, no? And so, with that, I would say, hindi lahat ng scoliosis nakakatakot, hindi lahat inooperahan. So, wag po tayong matakot sa scoliosis.
Ayan, thank you very much again. Ako, talagang ang dami namin natutunan sa'yo and not because you're my friend, okay? And talagang alam ko naman from the very start, you're very brilliant and highly skilled, okay? And thank you very much once again, Dr. Ann Kathleen or Dr. Pebbles Ganal-Antonio from Makati Medical Center.
Sa Makati Medical Center, we do have a group of spine specialists, no? And we are very much equipped to do our x-rays here and to do our interventions, no? Together with other specialties such as anesthesiology, rehab, no? We get to manage our patients very well here. So kung kailangan ng brace, na re-refer namin sa rehab, or kaya kung kailangan namin operahan, post-op, andyan ng friends natin sa ANES, andyan yung neurologists natin, sila ang nagmo-monitor ng pasyente habang inooperahan, at of course, yung mga cardio and pedia namin. So, we are practically a one-stop shop when it comes to scoliosis kasi kayang-kaya natin dito ayusin.
Marami kasi sa mga bata kada taon ay nakararanas ng ganitong kondisyon. Kaya nako, ating alamin ano-ano nga po ba ang mga dapat gawin ng ating mga kasangbahay. Let's watch here at Baby Talk.
Good morning mga kasangbahay. I am Dr. Katrina Florcos Dacana, your pediatrician for today. Today, pag-uusapan natin ang scoliosis. Alam nyo ba, ang scoliosis ay ang pagkakaroon ng hindi karaniwang pagtagilid ng korbada ng backbone or ng spine. In fact, hindi lahat ng korbada ay maaaring ituring na scoliosis. Kaya naman, for today's episode, ating alamin kung ano ang scoliosis at kung paano ba ang treatment dito para sa mga bata. So, let's start the discussion now. Ang scoliosis ay isang deformity sa backbone or spine. The spine has a side-to-side curve measuring 10 degrees or more. Normally, ang spine ay tuwid kung tinitingnan mula sa likod. Kung bata ay may scoliosis, ang spine ay may S or C shape. It would look like the child is leaning to one side and the curve can happen on the right, on the left side, or both sides in different sections of the spine. Ang scoliosis can affect people of any age, pero it is most common sa mga adolescents at teenagers. The most common type ay yung tinatawag na idiopathic, wherein yung cause is unknown. It could be due to hereditary factors. Ang next type naman is yung congenital scoliosis na nakikitang spine abnormality pagkapanganak pa lamang ng bata. So, ang condition nito, it's quite rare naman. Ang neuromuscular scoliosis naman, it happens kung yung curvature of the spine is caused by abnormalities in the muscles and the nerves that support the spine. So, examples ito would be yung mga pasyente na may cerebral palsy, spina bifida, tsaka muscular dystrophy. Ang most common symptoms of scoliosis would be, for example, mapapansin niyo yung bata, yung head niya hindi siya centered with the rest of the body. Mapapansin din na may difference sa shoulder height, sa height ng hips or ng balakang. Mapapansin din na mas prominent minsan ang isang shoulder blade than the other. And mapapansin din na may pagkakaiba with the way the arms hang beside the body kapag tumatayo ang bata. Mapapansin din na ang height of the sides of the back when the child bends forward ay meron ding difference. Yung doctor nyo will usually conduct a complete medical history and thorough physical examination to diagnose scoliosis. Now, if your doctor suspects scoliosis, pwede siyang mag-request ng X-ray, CT scan o kaya ng MRI depende sa kaso ng bata. And paano nga ba tinitreat ang scoliosis at saka what age can it be corrected? Usually, ang treatment of scoliosis will depend on your child's symptom, age, general health, and how severe the condition is. Yung treatment is not always necessary for very young children because their spine may straighten as they grow. Pero if the curve does not correct itself, there is a small risk na it could reduce the space for the organs to grow, so kailangan ang careful monitoring by a doctor. Ilan sa mga treatment options would include number 1, observation and repeated exam. So your child will need to see the doctor regularly para ma-check yung curve ng kanyang spine, if the curve gets worse, or how skeletally mature your child is. Curving of the spine kasi often slows down or stops after the child reaches puberty. Now, pwede rin ang bracing. If the curve of your child's spine is getting worse, your doctor will probably recommend to wear a back brace habang lumalaki siya. So this will not correct the curve, but it might help stop the scoliosis from getting worse. The third option is surgery. Your child might need surgery when the scoliosis gets worse or if the curve measures 45 degrees or more on an X-ray and bracing has not slowed down the progression of the curve. Ang batang may scoliosis can still exercise and participate in physical activities. While it will not cure scoliosis, exercise might lessen any potential reduction in your child's physical function over time. Some of the sports that can help scoliosis would include swimming and gymnastics. When the treatment is over, people with scoliosis are able to live full and active lives. As long as the child gets the right treatment, habang siya ay maliit pa lamang or teenager, their spine usually won't continue to curve after they're done growing. And that's it mga kasangbahay. Sana ay marami kayong natutunan sa araw na ito. And as always, please consult your pediatrician for your baby's health. Thank you for watching today's episode. Again, I am Dr. Katrina Flor Cruz Dacanay. You may reach me through my Facebook page, Dr. Katrina Flor Cruz, YouTube channel, Dr. Katrina Flor Cruz, and Instagram and TikTok, katrinamd.ph. See you in our next episode.
Thank you, Dr. Katrina Flor Cruz Dacanay, for sharing some valuable insights to shed light on this condition. Ako, kaya po sa mga nanay at tatay dyan, sana ay nakatulong ito sa inyo para po sa ating mga anak. Mga kasambahay, ako, sana ay marami po kayong natutunan sa ating talakayan. Pero bago po ang lahat, don't switch your channel dahil magbabalik po ang Doctors on TV. Welcome back! And of course, binabati ko po yung aking mga chikiting, si Ian, si Iyo, and of course, hi to EJ and Dr. Elaine Paul Cabodil. And syempre, nanay and tatay, I love and miss you both. And of course, hi to my patients sa Barba Cabodil Holistic Health Group. So that's all for today, mga kasangbahay, and hoping to see you all again next week for another episode. Muli po, maraming salamat po sa inyong lahat. Ito po si Dr. Sara Barba Cabudil. Let's make it a habit to learn about good health. Only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart, located at Amarsolo Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor Ayala North Exchange Tower 1, Legazpi Village, Makati City. Mestiza soaps. Mestiza soaps are made with natural ingredients and a combination of vegetable and fruit extracts, which can be also used by children and pregnant women. Good news is that these beauty products are vegan and cruelty-free. For inquiries and orders, contact 0969-175-4231-33 or 02-8824-5217 or 02-881-30320. Organic acai. Support your health with a 100% organic superfood supplement, Organic Acai Premium Blend and acai freeze-dried capsules. Rich in powerful antioxidants, fiber, amino acids, vitamin C, omega fats, and other essential nutrients the body needs to help build stronger immunity against illnesses and help increase your energy. Organic acai is available in all Mercury drugstores and other leading drugstores and supermarkets nationwide. Linden Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360, or you can email them at lgcsalesco@gmail.com. And of course, salamat sa ating partner, ang DepEd Santa Rosa, sa pakikiisa sa ating atikain na maibahagi ang kaalamang pangkalusugan. Clinica Figura. You may contact them at 0917-317-7272. Medical Depot. Healthy Nom Nom Food. Barba Cabudil Holistic Health Group, located at Unit 1531, Centurion Medical Makati, Century City, Makati. You may contact 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Please like and follow Facebook page, Dr. Sara Barba Cabudil. Special thanks to Dr. Gia Grace B. Sison, Head of Makati Med Wellness Center. Attorney Pilar Nenuga P. Almira, President and CEO. Dr. Saturnino P. Javier, Medical Director. Ms. Arlene L. Sonco, Senior Vice President. Ms. Monica Reyes Dizon, Assistant Vice President. Mr. Mark Funelas, Unit Head Manager, Communications and Special Projects.